Hey everyone, we're tackling a topic today that's close to my heart, both as someone who remembers freaking out for his Nclex. It's measles, a highly contagious viral infection that's unfortunately making a comeback in some parts of the world. As nurses and future nurses, you're on the front lines of healthcare. This video is your comprehensive guide to everything measles. We'll cover the virus, how it spreads, the telltale signs and symptoms, and how to provide the best possible care for your patients. Let's get started. So what exactly is measles? It's caused by a single-stranded RNA virus from the Paramyxoviridae family. This virus can hang out in the air on surfaces, just waiting to catch a ride on respiratory droplets. Once it gets in, it goes straight for the respiratory system, multiplies, and spreads throughout the body. Think of measles as the ultimate social butterfly. It loves to spread. The main way it jumps from person to person is through respiratory droplets. When someone with measles coughs, sneezes, or talks, those tiny virus-filled droplets get launched into the air. If you're unvaccinated and in the same room with someone who has measles, you have a 90% chance of getting infected. That's why hand hygiene and vaccination are so crucial. Measles isn't subtle when it comes to symptoms. It starts with prodromal symptoms: fever, hacking cough, runny nose, and red watery eyes. The real giveaway Nclex spots, tiny white spots with a bluish-white center inside the mouth. These are a classic sign of measles. While those initial symptoms might seem like a bad cold, measles is not something to mess with. It can lead to serious complications, especially in young children, pregnant women, and anyone with a weakened immune system. We're talking ear infections, pneumonia, even encephalitis, inflammation of the brain. Diagnosing measles is like putting together a puzzle. We look at the patient's medical history and do a physical exam, checking for symptoms like Nclex spots and the characteristic rash. To confirm the diagnosis, blood tests can detect measles-specific antibodies. PCR tests can find the viral RNA in blood or throat swabs. There's no magic cure for measles. Treatment is about managing symptoms and supporting the body. That means rest, fluids, and over-the-counter meds to bring down the fever and ease aches and pains. For some patients, especially kids, vitamin A can be a game changer. The best way to fight measles is to prevent it in the first place. That's where the MMR vaccine comes in, protecting against measles, mumps, and rubella. The MMR vaccine is incredibly safe and effective, 97% effective after 2 doses. It's crucial to get kids vaccinated on schedule. Measles is a public health concern. Public health officials work tirelessly to control the spread, including isolating infected individuals and providing vaccinations to those exposed. Public awareness campaigns educate people about the importance of vaccination. As nurses, you play a vital role in the fight against measles. You'll monitor patients for complications, provide supportive care, and educate families about the disease and its prevention. For hospitalized patients, remember to implement airborne precautions and practice good hand hygiene. Future nurses, let's make sure you're ready to rock the Nclex. Focus on understanding how measles spreads, its signs and symptoms, and potential complications. Remember, vaccination is key for prevention, and supportive care is crucial for treatment. That wraps up our deep dive into measles. By understanding measles, you're better equipped to provide exceptional care and contribute to a healthier community. Until next time, stay curious, stay informed, and stay healthy.